Next session, may I please call on Dr. Saji, Chief Consultant, Department of General Surgery, Holy Cross Hospital, Kollam. Dr. S.REEKUMAR, former Professor, Department of Pediatric Surgery, Calicut. Dr. Shah Jahan, Associate Professor, Department of General Surgery, GMC, Calicut, to chair the next session. The presenter for the session, Dr.S.SREEKUMAR, Professor and HOD, Department of General Surgery, Government Medical College, Thrissur.
Hello, ladies and gentlemen. Here comes something beyond surgery. And what I learned from the speaker is that, which is something, an innovative idea, which is started at Thrissur Medical College. Let us hear from the speaker. Sir, please.
Thank you for the introduction. Good afternoon, everyone. It is just a little out of the way. Rather than being technically sound, knowledgeable, skilled persons, I think surgeons has to be compassionate also to treat the disease, not to treat the disease, but to treat the patient. So I just want to share with you my experience during the last 8 years regarding this. In 2016, when I was the staff advisor for the college union, I just heard that a few students went to Amala Medical College to donate hair, to make wigs for the cancer patients who lost hair due to chemotherapy. So myself and also the union chairman, secretary, and there is a charity wing of the students. It was Pradiksha, known as Pradiksha at that time, now it is known as Punarjani in Thrissur Medical College. We all sat together and had a discussion about this and formulated hair to care. And we got this was the initial brochures, and we got the official permission from the principal. So a primary survey was conducted. So after our treatment, around 50 patients become hairless every month in Government Medical College Thrissur alone. That was in 2016, mainly due to chemotherapy for carcinoma breast, colon, ovary, and lungs. And what happens to them? By the second or third chemo, they start losing their hair. Some people who can afford a little bit extra money go for some synthetic wigs, which is made of fiber, which is heavy, which is cumbersome, not aesthetically appealing, as well as that produces increased sweating. And they throw it off within a few weeks and just get confined to their homes, covering their scalp with a black cloth. The problem is human hair wigs are costly. Do you know the cost of a good quality human hair wig? It costs around 25,000 to 50,000 rupees. And then we thought, why don't we use the patient's own hair? You must have seen in the Malayalam film, ഞണ്ടുകളുടെ നാട്ടിലൊരു ഇടവേള. ഒന്നാമത്തെയോ രണ്ടാമത്തെയോ കീമോ കഴിഞ്ഞ് ശാന്തികൃഷ്ണ ബാത്റൂമിൽ മുടി ഇങ്ങനെ കെട്ടിക്കിടക്കുന്നത് കാണുന്നത്. So this made us think, why don't we counsel the patients and make them donate their hair before they lose it? So we started in this way. We made the patients donate their hair. Either when their relatives come to know about this, few friends or relatives were also willing to donate hair. So this made me go into the depth of this big business. It needs around 400 grams of hair to make one good quality wig. The hair should be 12 inches to 16 inches long. So to get 400 grams of hair, we need at least 3 donors. And the cost of human hair, long human hair, it costs around 50,000 rupees per kilogram. That is why this much prohibitive expense is there. So in the neurosurgery wards also, hair is being wasted. Females undergoing craniotomy, and also in emergency also we get hair. So the students, we mobilize the students to collect hair from different sources. So the beneficiaries were identified, hair collection was done. Then we found out an agency, one Rajiv and Sida. Rajiv is no more now. Sida's sister had malignancy. She learned the technique of making wigs for her sister. And they just make it for us for a nominal cost of working cost of only 2,000 rupees. So we collected the hair, made the wigs, then sterilized it properly, and then gave to the beneficiaries. And also the follow-up register is kept with their Aadhaar card and photo. And after 6 months or 1 year, when they regain the hair, we collect it back and it's being reused after sterilization. A label is also kept inside the wig that is not to be misused. The program was officially inaugurated by none other than Mamta Mohandas. When I contacted Mamta, the only question she asked, she said, okay, on Jan 27th, I will be in Trichu. And how do you sterilize the hair? Because they will be immunocompromised. No, at that time, she was taking chemo in US. Oh, then I contacted the microbiology department. With their consultation, we used to wash the hair, first diesel washing, followed by shampoo washing, then heating it to 60 degrees centigrade to make it somewhat germ-free. Mamta's presence and this was a boon to many patients. Not alone patients. To be frank, it is the husbands who become എന്താ പറയേണ്ട സാധാരണഗതിയിൽ തകർന്നു പോകുന്നത് ഹസ്ബൻഡ്സാണ് വൈഫ്സ് ഹെയർ ലോസ് വന്നു കഴിയുമ്പോൾ ആൻഡ് ദേ വർ ദ മോസ്റ്റ് ഹാപ്പി പേഴ്സൺസ്. വോളിയം And Dr. Renia is seen in the picture. She is additional professor of medicine. She donated her hair along with her daughter just before the function. And this little girl also came from Kecheri showing the newspaper cutting, and she also donated hair for this. And in another function, Dr. Jaykumar came and did the big donation in another function. These are the happy patients in the initial patients. And on another Women's Day, we again donated few hairs, and this is the second person is Mrs. Jolly Joy Alikas. Actually, fundraising was a problem in the initial days. My family donated 50,000 rupees knowing this good cause. And knowing that Mamta, usually actors, they collect money from us for coming for these sort of functions. She donated 15,000 rupees, which was with her mother for the good cause. And Jolly Joy Alikas, wife of Mr. Joy Alikas, she donated 1.5 lakhs. So we thought, why should we keep on asking others? By the time 2-3 years gone, 300, 400 wigs were given, and the students who started working for this became house agents. Then I asked them, why don't you spend 100 rupees? I mean, that you spend for a good milkshake per month for this good cause. So the house agents also started donating. During their convocation, this is Sarah Joseph giving the wigs. So house agents and postgraduates also, and apart from the faculty members, started donating for this. Some anti-propaganda was also there in the initial phase from the wig manufacturers, but later on, when they were convinced that this is not at all going to affect their business, that gradually settled down. Then Dr. G.V. Prakash came as external examiner from Tirupati. So I told him about the problem of getting good hair. He said, okay, let me have a try. And in the history of Tirupati Tirumala Devasam, for the first time and the last time, they donated hair free of cost, 10 kg hair, which is worth 5 lakhs to us. And we gave them the list of the beneficiaries with photographs after making the wigs. Usually it is auctioned from Tirupati. More than 800 wigs were given during the last 8 years, which is worth 2 crores. I can happily say it was all given free of cost. I cannot forget the names of Dr. Ajayan, who is in charge of the charity wing, then Rania Isaac, Dr. Ajit and Dr. Mahadevan from oncology. Sir is not with us now. And Dr. Andrews, who was the principal when the program was inaugurated, and the nursing staff. Let us see what happens to the hair once it is donated. Dr. Anagha, who was a surgery resident that time, she donated her hair, and she is now assistant professor of urology in Pariyaram. So the students gradually got trained to do this sort of work. They conducted awareness programs in schools, churches, and voluntary organizations were giving us hair. Then during COVID time, online campaigns were conducted. Online donations also we get, and we give certificate to all the donors. And one girl from Thrissur who attended civil service interview, she qualified. She said this certificate, good value was given for this certificate by the interview board. So I feel surgeons can be a motivating factor to improve the quality of life of our patients. Apart from the surgical treatment, I feel we can offer something more. That is the message I want to convey to the next generation. This is only a small thing which we are doing. And involving with the family members also help us to give better care in a compassionate way. And in what all ways we can go beyond surgery, I am leaving it to the next generation. This is just to provoke your thought process to do something. And now this is happening. Just see what is happening now. The students alone manage it. Just a supervision is needed. With this small clip, I am stopping. So if I can mobilize 10-15 students from out of the 150 students every year to do these sort of activities, I feel the mission is successful. Thank you very much.
Thank you very much, sir.
Thank you, Sreekumar sir, for the enlightening speech. Actually, you could have, every tertiary care center, they could have followed this program very nicely. One direct question to you, sir. Do you have any threat from this hair making industry?
Wig manufacturers initially made some online propaganda against this, but we convinced them that this is not at all going to affect them. This we are supplying only to very poor patients who cannot afford costly wigs. Then that all gradually settled down.
A very good service.
Thank you, sir.
Why our organization could promote this? I think the social service wing will look into it. Thank you, sir. Thank you.
Okay, thank you.
Thank you very much, sir. May I request you to kindly stay back, sir? SREEKUMAR, sir, please, sir. May I invite Dr. S.R.EEKUMAR now, Director and Chief Consultant, Saraswati Institute for Minimal Access Surgery, Trivandrum, to kindly hand over mementos and certificates to the chairpersons and the speaker of this session.